Lymphoma is a diverse group of blood cancers that originate in the lymphatic system, a vital part of the immune system. Lymphocytes, a type of white blood cell, become abnormal and multiply uncontrollably, leading to the development of tumors in lymph nodes, bone marrow, and other lymphatic tissues. Lymphoma is a complex cancer with various subtypes, treatments, and prognoses, making it challenging to navigate. In this comprehensive guide, we will explore lymphoma in depth, covering its staging, prognosis, types, treatment options, promising therapeutics, risk factors, and support resources. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Understanding. Lymphoma staging. The staging system for lymphoma is a critical tool that helps determine the extent of the disease and guides treatment decisions. The two primary staging systems for lymphoma are the Ann Arbor staging system and the Lugano classification, which is a revision of the Ann Arbor system. These staging systems classify lymphoma into four main stages. Stage 1. The cancer is confined to a single lymph node region or a single extralymphatic site. Stage 2. The cancer involves two or more lymph node regions on the same side of the diaphragm. Stage 2, or an extralymphatic organ and its adjacent lymph nodes. Stage 2E. Stage 3. The cancer affects lymph node regions on both sides of the diaphragm. Stage 4. The cancer has spread to distant organs or tissues, such as the bone marrow or liver. In addition to the stage, the letter A or B may be added to describe the patient's symptoms. A indicates the absence of significant symptoms. B indicates the presence of significant symptoms such as fever, night sweats, or unexplained weight loss. Prognosis for early stage versus late stage lymphoma. The prognosis for lymphoma varies based on the stage and type of lymphoma. Generally, early stage lymphomas, stages 1 and 2, have a more favorable prognosis than late stage lymphomas, stages 3 and 4. However, this is a simplification, as each subtype of lymphoma has unique characteristics. Early stage lymphoma, stages 1 and 2. In many cases, patients with early stage lymphoma have a good prognosis, with a high likelihood of cure. The specific outlook depends on factors such as the subtype of lymphoma, age of the patient, and overall health. For example, early stage Hodgkin lymphoma, HL, has a cure rate exceeding 90% with standard treatments, while some subtypes of non-Hodgkin lymphoma, NHL, also have high cure rates. Late-stage lymphoma, stages 3 and 4. Late-stage lymphomas generally have a more guarded prognosis. However, advancements in treatment, including targeted therapies and immunotherapies, have improved outcomes even for advanced lymphomas. The prognosis remains highly variable, with some aggressive subtypes having poorer outcomes compared to indolent, slow-growing subtypes. The 5-year survival rate for stage 4 HL can range from around 60% to 80%, but this varies among subtypes. Types of lymphoma is categorized into two main types: Hodgkin lymphoma, HL, and non-Hodgkin lymphoma, NHL. Within these broad categories, numerous subtypes exist, each with its own characteristics and prognoses. Hodgkin lymphoma, HL, nodular sclerosis. Hodgkin lymphoma, NSHL. NSHL is the most common subtype of HL. It often presents with localized lymph node involvement and has a high cure rate, even in advanced stages. Mixed cellularity Hodgkin lymphoma, MCHL. MCHL is more common in older adults and may be associated with a less favorable prognosis, especially in advanced stages. Lymphocyte-rich Hodgkin lymphoma. This subtype has a favorable prognosis, and treatment outcomes are generally excellent. Lymphocyte-depleted Hodgkin lymphoma. This is a rare and aggressive subtype of HL, often associated with a poorer prognosis. Non-Hodgkin lymphoma, NHL, diffuse large B-cell. Lymphoma, DLBCL. DLBCL is the most common NHL subtype, but outcomes vary. Some DLBCL cases can be aggressive and require intensive treatment, while others respond well to therapy. Follicular lymphoma, FL. FL is an indolent NHL subtype with a relatively good prognosis. It tends to grow slowly and may require treatment at later stages. Mantle cell lymphoma, MCL. MCL is an aggressive subtype of NHL with a less favorable prognosis, particularly in advanced stages. Chronic lymphocytic leukemia, CLL, small lymphocytic lymphoma, SLL. CLL/SLL is often slow-growing and may not require immediate treatment, particularly in early stages. Burkitt lymphoma. This is a highly aggressive NHL subtype, but with intensive treatment, it can have a good prognosis. Peripheral T-cell lymphoma, PTCL. PTCL includes several subtypes, some of which have more aggressive courses and less favorable prognoses. Hodgkin's lymphoma, HL, versus non-Hodgkin's lymphoma, NHL, a comparison Hodgkin's lymphoma, HL, and non-Hodgkin's lymphoma, NHL, are both types of lymphomas, which are cancers that originate in the lymphatic system, a vital part of the immune system. While they share similarities, such as their origin and the presence of abnormal lymphocytes, there are key differences between these two categories of lymphoma. Cell of origin. Hodgkin's lymphoma, HL. HL is characterized by the presence of Reed-Sternberg cells, which are large, abnormal B lymphocytes, white blood cells. These cells are typically surrounded by a background of other immune cells. Non-Hodgkin's lymphoma, NHL, encompasses a wide range of lymphomas, and they can originate from various types of lymphocytes, including B cells, T cells, and natural killer, NK cells. The majority of NHL cases involve B cells. Incidence and prevalence. Hodgkin's lymphoma, HL. HL is less common than NHL, accounting for about 10% of all lymphoma cases. It is more prevalent in young adults and, to a lesser extent, in older adults. Non-Hodgkin's lymphoma, NHL. NHL is more common and includes a broad spectrum of subtypes. It can affect individuals of all ages, and the incidence increases with age. Clinical presentation, Hodgkin's lymphoma, HL. HL often presents with enlarged lymph nodes, particularly in the neck, armpits, or groin. It is frequently associated with symptoms such as fever, night sweats, and unexplained weight loss. Non-Hodgkin's lymphoma, NHL. The clinical presentation of NHL can vary widely based on the subtype. It may involve lymph node enlargement, but NHL can also manifest in extranodal sites, including the stomach, skin, or bone marrow. NHL symptoms can be similar to HL, but they vary depending on the subtype. Promising therapeutics for lymphoma advancements in lymphoma treatment are ongoing, with several promising therapies undergoing FDA approval processes. Some notable therapeutic approaches include immunotherapy. Immune checkpoint inhibitors like Keytruda and Opdivo have shown promise in treating relapsed or refractory Hodgkin lymphoma and some NHL subtypes. CAR T-cell therapy. Chimeric antigen receptor T-cell CRT therapies, such as axicabtagene ciloleucel and tisagenlecleucel, have demonstrated remarkable success in treating certain aggressive lymphomas. Targeted therapies. Drugs like ibrutinib, venetoclax, and lenalidomide are being investigated for their efficacy in treating various lymphoma subtypes, including CLL, SLL, and FL. Bispecific antibodies. Bispecific antibodies like blinatumomab have shown promise in treating certain types of NHL, such as DLBCL. Why lymphoma is a tricky cancer. Lymphoma presents several challenges that contribute to its complexity. Heterogeneity. Lymphoma encompasses a wide range of subtypes, each with unique characteristics, treatment responses, and prognoses. Tailoring treatment to the specific subtype is crucial. Indolent versus aggressive. Some lymphomas are slow-growing and may not require immediate treatment, while others are aggressive and necessitate intensive therapy. Relapse risk. Even when initially responsive to treatment, lymphomas can relapse, requiring further intervention and treatment adjustments. Late effects. Survivors of lymphoma may experience late effects of treatment, such as secondary cancers, cardiovascular issues, and fertility problems, necessitating ongoing monitoring and care. FDA-approved medications for lymphoma. There are numerous FDA-approved medications for various lymphoma subtypes. Some examples include rituximab, a monoclonal antibody used in various B-cell lymphomas, brentuximab vedotin for Hodgkin lymphoma and certain T-cell lymphomas, ibrutinib for CLL/SLL and other B-cell lymphomas, venetoclax for CLL/SLL, Keytruda and Opdivo for Hodgkin lymphoma and certain NHL subtypes. For information about promising lymphoma clinical trials, visit onclive.com. Intravenous vitamin C has shown promise for lymphoma. This is described in more detail in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. Risk factors for developing lymphoma. While the exact causes of lymphoma are not fully understood, some risk factors and associations include age, incidence increases with age, family history of lymphoma or other cancers, immunodeficiency disorders including HIV/AIDS, exposure to certain viruses, for example, Epstein-Barr virus, human T-cell lymphotropic virus, exposure to certain chemicals and pesticides, autoimmune diseases or immune system disorders, prior radiation or chemotherapy, organizations and resources for lymphoma treatment. Several organizations provide valuable information, support, and resources for individuals dealing with lymphoma. The Leukemia and Ampere Lymphoma Society, LLS, offers support, educational materials, and funding for research. Lymphoma Research Foundation provides information, support groups, and research funding. In conclusion, lymphoma is a complex cancer with a diverse range of subtypes, each requiring a personalized approach to diagnosis and treatment. Advances in therapies, including immunotherapies and targeted treatments, are improving outcomes for many lymphoma patients. Access to resources and support organizations is essential for individuals navigating the challenges of lymphoma diagnosis and treatment. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.